Hello and welcome to the Manifesto. Here on Manifesto, we look at the promises of the various political parties as we prepare for the December election. Today, the focus is on the NPP, the governing New Patriotic Party. If you look at the documents of the NPP, they've lined up a number of promises the party hopes to achieve if or when Dr. Bawumia becomes the president of Ghana. When I come back from the break, I'll tell you who I'm doing this show with and what the party is promising as far as the health sector is concerned. You're welcome back to the Manifesto. As I said earlier on the Manifesto, we look at the various promises of the various political parties as we prepare for the December election. Today, we are focusing on the NPP Manifesto. If you look at the 260-page document, the party outlined a number of things it hopes to achieve if Dr. Bawumia becomes president of the Republic. Today, the focus is on the health sector. The NPP has made a number of promises within that particular sector. My guest today is Dr. Anthony Nsiah Asare. He's the presidential advisor on health and a key member of the Dr. Mahamudu Bawumia campaign team as far as the health sector is concerned. We'll have a discussion on what the promises are as far as the health sector is concerned and what Dr. Mahamudu Bawumia seeks to improve from the Akufo-Addo administration as far as the health sector is concerned. Doc, thank you very much for your time.
Yeah, thank you very much, Sam.
With some few days to the election, how is preparation on your side? Is NPP winning?
Yeah, by the grace of God, the NPP is winning. And I'm very sure that come December 7th, the good people of this country will look at the good works that His Excellency Nana Dankwa Akufo-Addo, with the support of the incoming president, inshallah, Dr. Alhaji Bawumia, have done for the past 8 years. It's a lot of things that this government has done, especially in health.
The more reason why you're here so that you talk about what the Akufo-Addo administration has done in the health sector and what Dr. Mahamudu Bawumia seeks to improve upon if he's given an opportunity to become president. So, Doc, behind me here is a document I've gone through. It talks about what the NPP has done in the health sector in the last 8 years and what the party seeks to do if given the opportunity to continue the reins of governance in this country. So, just come with me to the screen. At this particular time, you said what we have done. Doc, what really have you done? If I go through this document, I see a number of things. Talk about the National Health Insurance Scheme and the rest. Now, it says that at the end of 2008, the National Health Insurance Authority in Ghana boasted a total of enrollment of 12.5 million. But you say you have improved. What have you improved under the National Health Insurance Authority or the National Health Insurance Scheme?
Yes, I mean, if you look at National Health Insurance Scheme, you know, President Kufo was one of his campaign messages for 2000, from 96. He repeated in 2000, and God being so good, also the good people of Ghana listened to President Kufo. And he implemented it in 2003. He passed the law. Some people didn't even take part in the law. So I always say that those who boycotted health insurance law actually don't understand health insurance. So when we started actually operationalizing health insurance in 2005, I can say it with authority because I was one of the people who started it in Komfo Anokye.
Okay.
I know
you were the CEO of Komfo Anokye.
I was then the CEO of Komfo Anokye. I know what it was during the cash and carry period and what it became in 2005 when we started implementing health insurance. There was a ward, I'll give you a short story, in Komfo Anokye maternity, first floor. It was full of people who couldn't pay for their hospital bills.
Oh, wow.
Women who are operated, their children, I always say that the children will start biting them even before they come for them. Somebody's husband will go back to go and cultivate cassava or maize, harvest it, and then come and pay the bill. Sometimes we have to leave them and let them go as paupers. But immediately health insurance came, and we introduced it in Komfo Anokye. We had a stand there in Komfo Anokye where people were enrolling, irrespective of whether they are health insurance or not. And within a matter of 1 month, that ward became vacant, and we are using it, and they are still using it as the family planning office for the Deputy Director of Nursing Services. That's the story. That's how it is. And then later on, we also added children below 18. So the children's ward where we're also detaining people because initially health insurance was that one of the parents should be active member before the child also becomes a member. But the question that some of us were always asking, if you have very irresponsible parent, should that poor child suffer? So since that time, people are not detained, especially children and women. And you remember President Kufuor, even before health insurance, brought in also free maternal care.
Yeah.
So this is how health systems looks like. And this is how affordability of health is through health insurance. In 2017, when you took over, that's at the end of December 2016, there were about 11.6 million people who were active on health insurance. At the end of December 2023, we have 17.6 million.
Active members on the National Health Insurance.
I'm talking about active members,
okay.
Not anybody who have enrolled. People who enroll and maybe don't come back again. So active members was that. Health insurance have a policy, and their target is in the policy is that they want to achieve 100% universal health coverage, so that everybody in Ghana becomes active. If you look at the law as amended in 2012, it said that every Ghanaian, every person living in Ghana shall be a member of health insurance. What did you see before? At first, before you can even renew your health insurance, you have to go and sleep at the health insurance office. But now, because of His Excellency Dr. Alhaji Bawumia, the digitization transformation, you can now lie in the comfort of your bed. Just press your phone, *929#, and you can then renew your health insurance card and become active member so that you can enjoy health insurance. That is the beauty of it. 2, we have put in a lot of things in health insurance now that even if you want to send your claims, it's through about 80% of them are doing by e-claims or by electronic means. It cuts down fraud. It cuts down people trying to push in other things. And there's a lot of things that have been happening in health insurance to extend that now health insurance have now become something which have increased, and then Ghanaians are now enjoying health insurance.
On the screen now, you say the NHIS scorecard. You give a description, the year under review, and the like. You said that in between 2009 and 2016, the scheme decreased. 12.5 went down to 11.3 million people.
Yes.
In 2017 to 2024, you say it increased from 11.3 to 17.5. These are active members as you outlined.
Yes.
Okay, let's look at the renewal timelines. Manually, it was taking 3 weeks between 2019 and 2016. But now you say it's instant and digital. What do you mean by instant?
Instant and digital is that you can lie in the comfort of your home. Just go on your smartphone or any phone, just *929#. You can instantly renew your health insurance. At first, you have to go and queue.
Yeah.
You have to go and sleep there. People were sleeping there. And you see, what it was creating was that it was creating a lot of problems that we call adverse selection. So people go to sleep there when they are sick to be able to renew their health insurance so that they can go and use it after 1 month. So by the time the patient comes, it's already very ill. But the instant one means that you can renew your health insurance at any time. People even play with their phones and renew their health insurance. I even recently heard that you can even print your health insurance card and then snapshot it and put it on your phone so that you can show. And even going forward, you know that health insurance and National Identification Authority are doing the Ghana card. So very soon, you don't need even a new card. You use your health insurance card as one card. So once your card is active, it means your health insurance is active. Because mind you, all the water and everything that you buy, if you buy water, you are contributing to health insurance. You know that? Because you pay national health insurance levy.
Yeah, the levy, yes.
So why should you pay a levy and you are not part of the system? And there are other things that we also will talk about, which have now also will increase and boost. It gives a motivation to people to join health insurance.
Doc, let's talk about the special illnesses. You said between 2009 and 2016, none. But between 2017 and 2024, you have kidney issues, which we'll talk about, childhood cancer, leukemia, and tumor, and then sickle cell. So does it mean that the National Health Insurance covers all these particular illnesses?
Yes. Before then, before 2017, there was no, for example, no family planning. There was no childhood, the 4 common childhood illnesses of children were not added as they were not part of the benefit package. there was no benefit package for children with sickle cell disease, which is very big burden for us, for hydroxyurea. There was no women with breast cancers on Herceptin have also been added. And more recently, we've also added children. First, we started with children and adults. That's the vulnerable group. Children below the age of 18 and adults above 60. When we had a problem of dialysis, they were given free plus other 2 sessions per month for other dialysis patients. Even more recently, on Sunday, it has been announced by His Excellency, the Vice President, that now to cover everybody. After learning the lessons for the past 6 months, we now know that it will be sustainable.
So now everybody with a kidney or anyone with a kidney disease will enjoy free treatment.
Yes, on dialysis.
On dialysis.
Will enjoy free dialysis throughout the time that he's on dialysis.
In which hospitals? Have you made specification of which hospital or public hospitals?
It's from the beginning, it's public hospital, but I'm sure if you're doing it for Ghanaians, it should be all Ghanaians. I mean, every Ghanaian should enjoy. But if you go to a private hospital, which they charge more than what we have agreed to be the cost per hospital, then maybe you do what you call.
So, for instance, I can walk into the Kolebu right now. If I have an issue, they do it for me free.
Yes.
Get up, pick my bag, and off I go without making any payment.
Irrespective of your.
And the National Health Insurance is covering this.
Them.
A lot of people have talked about the cost and the sustainability, Doc.
You know, we've done it for the past 6 months.
Okay.
And we've realized how much it costs. There's a fixed charge for it, 494 Ghana cedis per section. The most of the cost of dialysis is in the consumables. So now most of the hospitals are now having dialysis machines, which are, you can use any consumables. So we are thinking about in the public health sector that we have to do bulk procurement and even manufacturing of those consumables in the country.
Here in
Ghana, and it's in our manifesto that we are going to have what we call the Ghana Pharma Pack, where we attract the private sector, we attract the foreign investors into the place where we have the Ghana Pharma Pack, so that we can manufacture most of these things. There's no reason why we cannot manufacture a lot of our things that we use in our health sector, and we have to import all of them. All these things are imported. So it strains on our foreign exchange. When the dollar goes up, it has to go up, and that's where the cost is. Apart from that, later on I'll tell you what we are going to do as comprehensive management of chronic diseases, including chronic renal failure, which people go in dialysis. And apart from, I didn't even finish, apart from the dialysis we have added recently, we have also added 4 common mental health diseases, like anxiety disorders, schizophrenia, and others, which to me was one of the things that I think we should have added a long time ago, because it will be something that is going to help all the mental health service hospitals. We've been hearing, for example, Accra mental hospitals, Ankafo have no food for the patients. People have to go and then give them donations and all sorts of things. And sometimes even cleaning becomes a problem, because mental health services is free. But if something is free, it means there should be budgetary allocation. And when things are not going, when there any crunch in the economy, it affects budgetary allocation. But health insurance, at least those who are running the hospital can go and credit even food whilst they pay for it later on, as other hospitals are doing. And luckily, what is important in health insurance now is that health insurance is now up to date with their payments.
Claims payment.
Claim payment.
Which was a major issue.
Major issue.
A very major one.
When we took over, there was 12 months arrears in payment. Now, they've paid up to August 2024 for all health institutions. So the law says that within 3 months, you present your claims, you have to they have to reimburse you. So the reimbursement is now up to scratch, up to what is in the law. And they are even bettering it. They are even setting up what we call the automatic tariff adjustment, so that when prices go up, automatically to go up, so that people will not say that we have to add this one doesn't cover co-payment. Co-payment is not in the law. In Ghana, co-payment is not part of our law. So if you do that automatic price adjustment, it means people will get their money as it is and they will not lose, including utility bills. So these are things that health insurance is doing.
Is health insurance still being capped?
Yes, there's capping.
Okay.
But I'm happy that at least during our time, we said that we are capping. I think it was capped about 25% or so. But now, as you speak, the capping has even come down because they've released a lot of money to health insurance over the past 1 year. That's why they are paying all their bills and everything. So if you know where the cap money is going, but in a situation where they left, somebody, NDC left 12 months arrears, where they claimed there was no capping. So the extra money that came into the National Health Insurance levy, where did it go to? At least there's transparency in the capping. But once we add all these diseases, once you increase the benefit package, it means automatically more money has to be given to health insurance. That is the solution to the capping. That's what I see it.
Now, let's look at the next slide. Okay, so dialysis, we've spoken about dialysis and the intention of Dr. Bawumia, he become president, on how it's going to be done. The next one, okay, so stay on dialysis, and then emergency health delivery, which has to do
ambulance.
With ambulance. It was a major issue.
Yes.
I remember in 2019, then President Akufo-Addo commissioned about 300 and something, ambulance to all constituencies, and some were left for other emergency. Now, before NPP came to power, how many ambulances was available, and how many of them were in use?
I think there were only about less than 50, which were semi-functional. Not that they were...
Semi-functional? What do you mean by semi-functional?
Most of them were not even fit for purpose.
Okay. And
those who were fit for purpose were not... I mean, sometimes they are not being used and all this. Not every district has an ambulance. You have to call and wait. But in 2019, His Excellency the President brought in 307 new fit-for-purpose modern ambulances, so that every constituency, all the 275 then constituencies have an ambulance.
It was a major campaign promise in 2016, yes. I guess, yeah.
Yes, and it came. And then we also try as much as possible to give even to some of the hospitals. So there are 307 new ambulances who came into the system in January 2019. And it helped us a lot during the COVID period. Yeah. So it's God who gave that vision to His Excellency President Akufo-Addo and Vice President Dr. Mahmoud Bawumia. If it wasn't that, it means people will be carried in taxis and in buses, and it will infect a lot of people. So that is one of them. Going forward, in our next, in our manifesto, what we are saying is that we are going to, ambulance service will be there, and then there will be a regulator, so that the private sector gets involved in ambulance service. And then we can then increase the number and the fleet of ambulances. We can also have other diversified ambulances like children's or neonate ambulances, air ambulance, boat ambulance. If the private sector is doing it, why not? And then two, we are also going to put ambulance under the National Health Insurance reimbursement document. Because to me, if ambulance which will pick me when I have a problem, a pre-hospital care to a hospital, and I'm a health insurance holder, and then maybe my purse is lost, for God forbid, when there's an accident, and the people have to now beg and they ask people for money to buy fuel into the ambulance, because it's being run through the government budgetary allocation. If there's no budget allocation released early enough, they will not have fuel. But if they are under health insurance, so that you move from one city to another city or intra-city, that's how it costs. The ambulance EMT person signs, the receiving hospital signs, and they send it for reimbursement. It means private sector will be very much interested to also put their money in ambulance. That's how private sector has put their money into healthcare delivery, because they have built hospitals, because they can also access health insurance. That is one thing we are going to do to revamp the ambulance services, and then get more ambulances into the system, get more diversified ambulances into the system, get air ambulance which can then pick people from one area to the other, and connect the ambulance services through digital means to the accident emergency centers. God being so good, all the Agenda 111 centers have national, accident emergency centers. And then we have now what we call the network of practice. That is the district and the sub-districts and the community level. And they also would then transfer they refer their cases to all the districts, because every district in this country after Agenda 111 will have a first referral center which has an accident emergency center, and then the ambulances will know where to go, not to carry everybody to Konfanochi, Kolebu, and then they say there are no beds, and there will be no beds in them, and they will lose a lot of patients unnecessarily. So that is what we have for National Ambulance Service.
Okay. So the screen now is the statistics which you mentioned earlier. Doc, let's look at the human resource.
Yes, human resource.
Human resource, which is very, very important and critical. It talks about the recruitment of doctors, nurses, and other health professionals. We live in a country where there is a brain drain as far as health professionals are concerned. We know of our friends, brothers, cousins who are all jackpine to the US, to the UK for better life as far as health professionals are concerned. What would the Bawumia government do to retain these professionals here in Ghana to take care of the populace?
Sammy, you see, brain drain is a phenomenon.
It didn't start today.
It didn't start today.
Okay.
Brain drain didn't start today. When I was a medical student some years back, we had very high level professors. When we finished medical school, we started house job. Most of them left the country. Because it's the means. I mean, if somebody is living in the country and he realizes that he can get a better condition of service or better life somewhere else, the person would drain.
Yeah.
A lot of people drain. In my class, when we finished school, we finished house job, about 3/4 of us brain drained.
Okay.
That time, Nigeria. Because Nigeria oil was booming.
Agege time.
Oh, okay. It was booming at a place. At a time, we were all at one place. It means that I was a brain drained.
Yeah.
I brain drained from when I was a very young doctor for 4 years. But after Nigeria economy started going down, we came back to continue our postgraduate training, and then we are back. So that's what happens. So there are push and pull factors. All what we have to do as a country or as a nation, that we have to then mitigate the push factors, things which push people to drain. When, during Kofo's time, we have what we call a health services salary structure. When the health sector was moved from government universal salary structure goods, where the salaries and allowances were joined together, and it became a lot of money because we were having what you call ADH and the rest. Government said, let's put it all together. The salary was very good.
Okay.
Nigerians started coming to Ghana. Some of them have even established where he married.
You had gone there, you came back, and now they are coming here.
They've coming to Ghana. So that's how it is. So people move to where there is, especially professionals.
Okay.
I don't blame any one of them. But the most important thing is that what are the simple, small things that you can do for people to stay in their country? One, every young professional, especially I'm talking about health professional, look at what first maybe what will make ends meet. Two, that where he is working, he has all the enabling environment very good for the person to work. I.e., if a nurse finishes school today and is posted to OT at PASA, when he goes there, will he have a place to put his or her head? So if there's accommodation readily available for the person, and there are also what you call the deprived area incentives or underserved incentives, that he knows that I'm moving away from Accra and go to maybe PASA or go to my hometown Trede. So that when I'm there, at least my salary, at least I'll have some more money added to my salary, because I cannot do locum, I cannot do this, I cannot do this, my children's education and everything. So when you are putting up a system for such a person in the underserved or rural community, you have to make sure that at least you make the person a bit comfortable. Free accommodation, which should be paid by government, by adding it to the salary so that you can pay directly from controller to whoever the owner of the house is, through extra allowance for being there because you cannot do other things that other people are doing. A kindergarten, a nursery, or a school, proper school for the professional. Yeah. And also making sure that the professional is promoted out of 10, and the professional can go and do studies out of 10. Cannot, if you are competing among very few places. Yeah. If you do all this, then you can keep the person, and the salary is slightly enhanced. You cannot pay the same salary as they pay in UK or US or anything of the sort. But when somebody wants to move to these places, he thinks about the family here and then what he's going to do. If he knows that he can look after the family comfortably to some extent, that's how it is. And then more importantly, the credit system. Outside, nobody uses his or her salary, even though they are paid well, to go and buy a vehicle, brand new vehicle, or to go and buy a house or build a house. If you are not very careful as a professional, by the time you finish building your house, you are about getting to 60.
Yeah. And
then you have put a double stack building that is 3-story or 2-story. You cannot even climb up there to go and sleep in your bedroom. So you should be able to have a mortgage system. And that is what His Excellency Dr. Alhaji Bawumia, the incoming president, Nsiah, is trying to put forward. So that we have a medical village, a complete medical village. And we are doing that one with the private sector. So the private sector, that he will get the off-take, that people will rent the house. Why can't he put such a accommodation for them? And the President Kufuor's government and President Kufuor has done it. We have seen it. The appeal court judges' residence in Kumasi. Yeah. Beautiful. Yeah. Everything is there. Why can't you do the same thing for health professionals in like a medical village? That is what we are going to think about to let people stay here. The next thing is postgraduate. Mm-hmm. Every doctor, every nurse wants to improve his or herself.
Definitely.
When we started the postgraduate training about 20 years ago, I think 2003, the number of young doctors who were leaving this country, even though the salary was not as the salary in the US or UK, about 90% plus retained. And they are the people who are keeping the system going now as professors and the rest. So if once people get early postgraduate system, they go to school continuously and make sure that they finish and then do their postgraduate and finish. People don't tend to migrate that way because here they are specialists, they are senior specialists. They become consultants. The same thing with nurses. Once every nurse here knows that when I finish school, even as a diploma, I can do my degree and do my MPhil and do my PhD. Why not? And then I can get some money to look after my kids. I know where my children are, wherever I'm working. And then, so the way to do it, so that we get a lot of all our professionals into the system, is to also decentralize postgraduate training, especially the clinical postgraduate training. I'm talking about the doctors and even nurses. And then you increase production. Not just production, but you increase production where you have a lot of things like skills lab and everything for nurses. I think that that's what you should do for all the people who are training in the health profession, and then recruit them and retain them. So it's training, recruitment, retention of those that we have recruited, and upgrading their skills and also upgrading their salaries so that they can have also proper end of service benefits. Or
at the end of this, doc, what people will say is the money.
Yes.
If I upgrade and my salary is still not what I expect, if I reach wherever I want to reach and my salary is still not get where I also want it to get, obviously I may consider running away, in quotes, to another country.
Yes.
What is the Dr. Bawumia plan for the allowances and salaries of these medical professionals that are in the system, and the one you will add on?
So Dr. Bawumia's plan for the future is, one, we will make sure that we will introduce and establish the already so much discussed and talk about deprived area incentives. We will operationalize it. Okay. That is one. Two, Dr. Bawumia's plan is that we will give decent houses in the form of medical villages to our health professionals who are going to work for us. Because most of the hospitals have some land, and we are going to use the private sector to do this. And then government will add it to the salaries of the workers and pay for it.
Okay.
Dr. Bawumia's plan is that, for example, at first there was what you call the car waiver, that people were bringing vehicles. It was abused, I will agree. But now with Ghana card, nobody can go in for car waiver maybe 3 or 4 times in a year. That one has been will be reintroduced for nurses and other professionals. In fact, as for the doctors, it has been even reintroduced this year. Not that we are going to do it, we have done it. Dr. Bawumia's plan is that to improve and upgrade the professionals, all the colleges, Ghana College of Physicians and Surgeons, Ghana College of Nurses and Midwifery, Ghana College of Pharmacists, and then we will introduce the Ghana College of Allied Health Sciences, that their fees, which they normally pay, will be absorbed as we have done for the doctors. for all the various colleges through the scholarship secretariat. Dr. Bawomia's plan for them is that we will use a credit system with the other real estate people to be able to get mortgage for people, for our professionals to build their own houses.
Okay.
And when they don't want to live in government houses and they want to build their own houses, we will try and get it for them. So even the car waiver, we believe that with the car manufacturing assembly plants in this country, not only for the old vehicles that they will import, they should be able to also get a system where they can also get high purchase for these vehicles within a system where it will not make them poor.
Comprehensive plan for medical
So this is the comprehensive plan for not only medical practitioners, but for all health professionals.
Okay.
And it even has extended even the car waiver and everything to the teachers.
Doc, we'll go for a break. When we come back, we'll talk about Zipline and then Agenda 111, which a lot of people have spoken about. You're still watching the Manifesto. We'll go for a quick break. When we come back, we'll talk about Zipline technology and Agenda 111. My guest today is Dr. Anthony Nsiah. He's the Presidential Advisor on Health. As far as the December election is concerned, today the focus is on the NPP, the Governing Unity Patriotic Party, and the focus is on health. What Dr. Mahamudu Bawumia is promising Ghanaians if he's given the opportunity to be President of the Republic. My guest today is Dr. Anthony Nsiah. He's a Presidential Advisor on Health. We'll be speaking a number of issues, the National Health Insurance, ambulance, and the rest. We are shifting to another discussion, which is Zipline. Zipline technology came into the country. A lot of noise were made in respect of what transformation is going to bring to the country's health delivery system. Dr. Nsiah is one individual who played an important role in the introduction of Zipline technology here in Ghana. Doc, Zipline came. A lot of people said it was making positive impact. What was the brain behind introduction of Zipline technology?
I was in my office one morning. I think it was a Wednesday, and I had a call from Dr. Bawumia.
Okay.
He was then in Silicon Valley, that he has gone to Silicon Valley, met some young men who are doing some wonderful things that he believed we should bring it to Ghana.
Okay, in Ghana.
It was already in
Okay.
Rwanda. That is transforming Ghana's health sector with automated on-demand delivery or the AI system. So that was in 2018. So quickly they came on Sunday, Monday they were in my office, and before even they started speaking, I said, I'm convinced. So the two of us then worked through a lot of systems, and then there was a lot of outcry that we should go and buy ambulances. That time they didn't know that we were working on 307 ambulances. And then why don't you go and do this? So we were adamant. I told them that because of what happened, especially blood, and Dr. Bawumia has a very interesting story to say about his father, who died because of blood, 1 pint of blood. You know, because of Zipline, a pint of blood can be given to 3 people.
Okay.
Yes, because you can fractionate the blood, and then you can give plasma, you can give the packed cells or the rest. So you can do everything of blood. Instead of giving it to one person as a whole blood, maybe he needs all the packed cells. We send the packed cells to them within a matter of not more than 40 minutes, the longest route. So we sat down. People also didn't know that Ghana government was not spending a peso in the setting up of the distribution centers. Ghana government was only going to benefit from the services. It's like giving you a letter to DHL. They will weigh the letter and give you a price, and then they will send it to wherever it is. That's how Zipline is all like. So we went to Rwanda to have a look at what they are doing there. Wonderful.
They were then operating?
They were operating, but only one center. But we realized that Ghana, we need more than one center. And we also asked that we will not do only blood. They were doing only blood. It's recently they are adding some other things to it. So no, we won't do only blood. We will do it for all the essential emergency drugs. And more importantly, our small places where they need only small amount of medicines. Why should you carry a lot of drugs to them and then they get expired? For example, Pediatocope. I went there when I was the Director General of Ghana Health Services. You use a boat. It's on the island. So I went and saw a lot of antibiotics and some medicines there, which were expiring. But if you're using Zipline, every morning they can give you what they need, and then you drop it and go away. So God being so good, with all the resistance, especially from our opponents, who said that we are coming to use it to watch women bathing in the villages. Now they are asking for it in their constituencies. So we have now 6 distribution centers across the country, which covers about 13 of the regions. And we have said that we will add 2 more distribution centers at Kintampo and at Funsi in Upper West. So I can cover the whole country. And then we can then distribute. In fact, when COVID came, it was wonderful that we had this Zipline, delivered over millions of vaccines. If you go to Northeast, where hitherto there's overseas there, maybe if it wasn't Zipline, they have the highest population uptake of vaccines, of COVID vaccines. And then we use it for even COVID the samples initially when we had only 2 labs, Noguchi and KCCR. They were carrying samples to them to test. Okay. And we use it for all the other things, including even Ministry of Education. For the first time, the last BEC, those in Secretary East, Afram Plain Secretary East, they wrote the exams of their people in the whole country at 8 a.m. because Zipline dropped the materials for them. I was even praying. So
it's not just only medicine you are dropping.
I was
examination materials.
I was praying that even December 7, Zipline should be able to have dropped the voting materials, which are not heavy, to all the centers so that nobody wait, and then by 7 a.m. everybody will vote. I'm sure it will come, maybe inshallah by 2028. So that's how it is. So we have the centers across the country. Yeah. We have 6 distribution centers doing wonderfully well, saving lives. You remember recently it was in the social media that an NDC constituency chairman who was going to campaign against the one who brought the Zipline was bitten by a snake, and he was saved by anti-snake venom from the Zipline. So we are keeping all the anti-snake venoms at the Zipline centers and distributing it. So that's the beauty of Zipline.
So the centers are found in the Upper East, and then Oti region, yes, the Bono East, the North, Western North, and
Eastern
then
region,
Volta region, and then the Eastern and Ashanti region.
Yes, and it covers the whole
entire country. So per the list, it covers 13 regions.
Yeah, 13 regions.
Okay. How do you intend to make it cover the entire country?
That's where we are coming to bring one to Upper West.
Okay.
So that it covers this zone that has not been covered. And another one will be at also Kintampo to cover this area. So that's how would
Dr. Bawumia government improve on Zipline?
Dr. Bawumia government we are working closely together with Zipline. Now, as you speak, there are 2 Ghanaians. So I haven't even spoken about the human resources improvement of Zipline. They've employed 200 very professionals, pharmacists, scientists, IT experts, and all this. And 2 of them are at Silicon Valley now doing the 2nd generation drones, okay, which can carry your medicines, because now that you are using the network of what do you call it, the electronic prescription, they can carry your medicine and come and drop it to you in your home.
In my house?
In your house. They finish it, God willing. I'm sure next year when Dr. Bawumia is the president, inshallah, they will come and pilot it in Ghana. They can even carry your food to you from the restaurant to you in your house. It will come, it will hang, it will come out of the receptacle and then come and drop the food. Whilst you are standing there, you pick your food or your medicine and go away. That's the 2nd generation, which will come to Ghana. 2, because of Zipline in Ghana and because of the caliber of people that they employ. In fact, 60% of all the 200 employees are ladies. There's a young lady sitting in Accra who is the African director of drones, Zipline drones in Africa. Now they have it in other countries. So he sits in Accra and directs them. So that is what has done to Ghana, to our young population. So I'm very happy about the job creation, very good jobs. I'm happy about also is teaching our JHS and SHS students within the catchment area what artificial intelligence is, not only what they read in the books. So that's a Zipline.
Interesting. So this one talks about the coverage and the areas.
So we started from Omanakon. Okay. We went to Mpaha Center, Vopsi, Sahiwe also, and Num and Kitekrachi. These are the 6 centers. And as I said, early next year, we'll add also Funsi in Upper West and also Kintampo in the Boon East.
So this is how the infrastructure looks like?
That's how it looks like.
Okay.
And then it takes, this is the Womanako Center, and this is their offices. It is a complete warehouse. So we have improved the supply chain management system in the health system. We've added a very important thing, and these are how it goes since 2019, 2020, 2021, what we've been doing. We distributed over 2.8 million doses of COVID vaccines. In fact, the Gavi Alliance, the Gavi for Immunization Alliance have now come to them, and they are working closely together with them so that they can take over the distribution of all vaccines in Ghana and maybe in Africa.
And in 2022, he said he saved over 6,341,000 lives. Through emergency.
And another thing that I haven't mentioned, when we have the anthrax outbreak in Northern region, it distributed 104,000 vaccines to the cattle so that it minimized it very quickly and it didn't get to human beings. And as I said, at such a farm place, these are the children writing their exams. At first, they will wait till about 12 o'clock before they write their exams. But now, 8 o'clock, they all started. And that's why I'm saying that I hope that going forward, during our when we are voting, Zipline will drop all these materials to the underserved areas.
So it offers two types of services?
Yes.
Which are these services, Doc?
So this is the instant service, and this is what we call the smart fulfillment area. Okay. So if you look at the instant service, the Zipline drones will deliver your products for a better and more convenient experience. And then it stores it. So they have -80-degree fridges. When the COVID vaccines came, and we need -80 degrees, Zipline was conveniently available for them. In fact, it was one of the few areas where we could store these things. So it's a complete storage area. And if you have entered one before, as if you are somewhere else, not in Ghana.
Interesting.
So this is what it looks like. And then the new one, I think I have the new one's picture there. If you go to the next, this is a new one. This is where it's just simple like this. It come and hang, and then the food will come from this, or the drugs will come from this compartment. Or your letter, very important letter. The banks can also use it. Everybody can use it.
So this is how the new one, which will come to my house if I make place an order or something.
This is how it looks like.
Okay.
And they built it, and 2 Ghanaians are there.
Controlling
to help it. In fact, they built 8 of them. The 2 Ghanaians who were working here before, they've taken them there because they are very smart in IT, and they are doing it with them.
This place has come to change the face of health delivery in this country.
In this country, and people from outside, Nigerians and the Egyptians, and even Indians, and even in the US, they heard about Zipline in Ghana. Remember when the vice president of US came here? He mentioned it. Yeah. It's not that they are doing it. Even though it was manufactured there, they thought it wasn't good for them. But from what is happening in Ghana, especially, we have even overtaken Rwanda, where we learned it from.
Okay.
So that's how the processes are like. So 8 a.m., the request comes in. By 8:40, it has been delivered. And you can send a request.
8:40, wherever you are.
Wherever you are. The delivery is done, and it's returning. So you know the request is done at 8 a.m.
8 a.m.
In 5 minutes, the fulfillment is done. That's the fulfillment means that they get all the necessary drugs and this thing. And then it's lunch within 10 minutes from the request. And within 25 minutes, it has delivered it. And then it's coming back to the station.
Are they able to meet the demand?
Yes. Even in the night, they get up, and if you need an anti-snake venom urgently in the night, it will supply to you. Hitherto, you have to wait. You see, the most important thing about Zipline is that somebody will say, oh, blood. You need blood. There's no O negative blood baby at Nsiah. Somebody has to take a car and move all the way to Kolego.
Or somewhere already, yeah.
And then he has to then bring the blood back. How many hours will it take? The patient needs the blood urgently, is bleeding. And there are stories like that. There are videos where people, not we are saying it, it's the patients themselves who are saying, those who have benefited from Zipline. And I'm happy, I'm very sure that the NDC chairman, I'm sure one of these days, will also come and give testimony of how he was saved. So it's saving lives.
It is.
So that's the impact.
Okay.
The number
delivered
of
9
million vaccine
so
doses. Yes, that is including the 2.8 COVID vaccines and childhood vaccines. And now when you are doing, for example, a campaign where we want to vaccinate all children for yellow fever, at first you have to bring some doses and then they will tell them that the vaccines are finished because they didn't calculate where a lot of people came. They have to then, people have to go home. Some of them may not come back, but you can be there and they say that, oh, there are 20 more people there. Zipline will come and drop the rest of the vaccine so that nobody goes home.
Interesting. Doc, let's talk about Agenda 111. It has become a very, very topical issue in recent times. President Akufo-Addo, in the peak of the COVID, made some major announcement that the country is going to build a number of hospitals to address the challenge as far as the health sector is concerned.
Yes,
you are one person who is more or less involved in Agenda 111. How many hospitals have been completed? How many will be completed before they are commissioned? And how many will not be completed before this tenure of this administration ends?
Yes, maybe before you go there, people think that everybody when is talking say, oh, Agenda 111. Since this government came into power, this government has completed 47 hospitals and clinics.
47?
Yes.
Which is not part of Agenda 111? Okay.
26 hospitals. For example, Kontombra, Swame, Mpoho, Takwan Swayim. Recently, President went to Asare, so Vice President has also gone to commission the one at MIM and the one at ADES, Dukrum and all sorts of things. There are 47 of them.
Okay.
This government came and met stalled Eurojet project which started in President Kufuor's time. The 2 regional hospitals in Wa and Kumasi, the military hospital at Aferi, and 6 district hospitals at Tepa, Chufupraso, Kwabenya, Konongo, Dumasi, Salaga, and where I think Bandao area or somewhere. So, and this government have also started other 17 projects which are not Agenda 111. Enyinem Accident Emergency Center, Obuasi Accident Emergency Center, they are 100 beds, about 80% completed. And then other things like, and then this government also came and met projects which were being done by the previous government and completed it. For example, Fomena, Kumawu, University of Ghana Medical Center, completion of University of Ghana Medical Center, and then Borgatanga Regional Hospital Rehabilitation, which was commissioned recently. Fomena and Kumawu were commissioned in August. This government came and met the previous government has 6 hospitals that they look for money, like President Kufuor looked for money for the Eurojet project, which they came for 8 years, they couldn't commission even 1. For the Eurojet project, for example, we've commissioned 6 of the hospitals. Affair is practically completed. I can tell you in confidence that this week, Affair will connect the sewage system and the soldiers will go and start working inside there. Sewia, which is the Ashanti Regional Hospital, will also going to connect the ECG line to the hospital lines, and then we can start doing the training there maybe next week. And I'm very sure that His Excellency the President or the Vice President will go and commission the 2. So it's only left of Salaga, which is about 70% complete. They didn't complete even 1. Their own hospital that if they even started, if you remember the 10 polyclinics that they did in Central Region, we came and met it and finished it and commissioned it in 2018. That is the ones in the Central Region. And then 5 of them were in Greater Accra. We started it in 2017 and finished it in 2019. We didn't leave it as they left the Eurojet projects. And then, apart from that, because of COVID, and the Vice President did this research and got to know that 88 of the 261 districts in this country have no district hospitals. And when the President, I think he has said the story before, when he asked me, I also asked the President, there are some of the district hospitals which are not district hospitals. They are just by name. And I gave a lot of examples. I'll give you an example. One example is the one at Afuano Southwest at Mankranso. Half of it got bent. It was a polyclinic. No, it was a health center. Then they turned it to a polyclinic, and then half of it got burnt, and they say it's a district hospital. So this government is putting up 101 district hospitals. Now, it's even 104 because we have added Karaga, Nsiah, and Nkuranza to it. So it's 104, but we still call it Agenda 111.
Okay.
7 regional hospitals. All the 6 new regions are having a new regional hospital. The state-of-the-art, fit for purpose. 2 psychiatric hospitals, because we don't have psychiatric hospitals apart from the coastal zone. There's no psychiatric hospital in the middle zone and also in the west and the northern zone. And then Accra Psychiatric Hospital Rehabilitation. And the president said he gave also that is going to start the Western Regional Hospital. So we've added it. Luckily, the Western Regional Hospital has even started at Apemedi in Ahanta West. As we speak now, because of land issues and all these things, and because of debt restructuring, 100 of the Agenda 111, that's 98 Agenda 111, and 2 psychiatric, the zonal psychiatric hospitals at Onwe in Joso municipality and Tamale have started at different stages of completion, from about 20% to some of them. Yesterday we called some of them, they are about 95%, 96% and finishing. And I can
96%?
Say, yes, and I can say in confidence that there are some of them that will be completed before even election and commissioned in the next 2 weeks.
In the next 2 weeks?
Yes, and the others that His Excellency the President will also add and commission before he leaves power. 33, that's 30% of the 100 which are started are above 70% completion. And these are the pictures maybe you can show to them.
There's some of the pictures.
So these are the Eurojet projects,
yes,
which we came and completed and commissioned it. And this is one of the hospitals, I think we came and completed it. Stay here. These are some of the hospitals I've been talking about.
Okay.
These are the 40, part of the 26 hospitals of the 47 facilities that we have finished. The revamp projects. One at Sabronum in Ahafuano Sadis, that's how it looks like. It's practically completed. They are doing testing of the material machines, and it's even, they are going to start. So
this one is different from the Agenda 111?
It's different from
the Agenda 111. This is the revamp project.
This is a revamp project.
Okay. And it's a 40-bed hospital?
The 40 beds hospital. No, they were putting 15 beds and 30 beds. We increased it to 40 beds so that they are complete hospitals. So you can go and they will go to Agenda 111. So I'll talk about it. This is the Cape Coast Isolation Center.
Okay.
You see, another thing that we have not also talked about is that during COVID period, we realized that we didn't have place to isolate patients, what you call the treatment isolation rooms.
The only place we knew was the Ga East.
It was turned into isolation center. It wasn't. It's now a hospital. Yeah. So this government has built 21 treatment and isolation centers. 13 of them have been completed across the country, not in one region. Across the country, at Adakulu, at Zibila, at Kumasi South, at Seria, at Nkinkesu, at Takoradi, Cape Coast, Accra, everywhere. Accra Fevers unit has been completely refurbished and
is it the one at Kolebu?
At Kolebu.
Okay.
So that when there's any pandemic, you have a place to put patients. That is the idea. That is how holistic we are looking at health systems for the past 8 years. So COVID taught us a lesson. And COVID taught us that we should have hospitals which will be Agenda 111, which are the centers where we put our patients. So these are all the new hospitals, Vamet hospitals. Yeah. So you go on, these are Vamet hospitals. And then, yes. Sure. No, so this
yes.
Agenda 111.
This Agenda 111?
Yes. So this Agenda 111 at Trede.
In the Ashanti region?
In the Ashanti region in the night. We have accommodation. We have a complete 100-bed hospital of accident and emergency center, of neonatal unit and pediatric unit. That's where small children will be and older children also will be. Of maternity home, of a kitchen, a mortuary, OPD, pharmacy, X-ray, laboratory. It's complete hospital. We have an eye department, dental department, ENT department, and consulting rooms. We have public health units inside the hospital, where the public health people will be there, so that after seeing the patient, you continue also overseeing the patient, and the accommodation attached. These are the places where you are going to, apart from these accommodation which are there, these accommodation units, we are going to put the medical villages there. As I speak now, those who want to build a medical village, I think they are even at Trade now, trying to see where the land is. It's private sector led. It also has a kitchen. It has 2 giant generators, 2 giant water tanks, energy room. And within the kitchen, which will be feeding the patients, there's also a dining room for the workers so that they eat there. There's a security place where people will then, security and commerce, where they will sell things inside the hospital in a building, not outside like what they do elsewhere. There are also areas where they are all 1-story buildings, apart from 8 of them which are story building because of land. And then we have courtyards where the patient, when they are sick, will not be lying only on their bed. They can come and sit in the garden. Yeah. It's a courtyard of trees and greens and benches where they can sit up, so that.
So when I go to Trade now, I'll find all these things.
When you go to Trade, you find these things. You can pass there today. You can pass through Bokoro in Hunter West. You can pass through Avidakwe. You can pass through Jolukuta. You can pass through Kajeji. They are all there. It's across the country. The region which doesn't have even plenty is 1 regional hospital and 2 district hospitals in Ahafo and also Savannah. Every region, Ashanti region has 20 of them. 1 psychiatric hospital and then 19 district hospitals. Ashanti region doesn't have hospitals. So this is Agenda 111. Anybody who has not seen it, this one is feely. So as I said, 100 of them have started. Out of the 100, they all didn't start at the same time because of some issues of land and all these things. Out of the 100 which have started, 33 of them, that's 30% of them, are 70% and above. And to me, practically, any construction is 70% and above is about finishing. So I can tell Ghanaians, very soon, maybe by next week, we'll do a press conference and tell them when His Excellency the President is going around to go and commission these hospitals.
How do we have to be fine? And finally, before we leave, how do we have to people who say that NPP Nyeshe when it comes to the health sector?
So today, I think anybody who has listened to me will know that NPP doesn't look at the health sector only at the buildings and the human beings. We are looking at this holistically. We are looking at the where people will go and access health, so that health will be very near to the people. That's why we are putting 111 and now 114 hospitals, including psychiatric hospitals, mental health services. We have also specialized hospital at Weija for children, which is about 80% complete. We have built, maybe you didn't show that, nephrology is in the urology and nephrology center, where we can then do also even renal transplant. It has 30 dialysis machines. All the regional hospitals in Agenda 111, which are yet to start because of debt restructuring, will have dialysis centers. So nobody will move from his region or her region and go and do dialysis outside the country, outside the region. Even some of the district hospitals in Agenda 111 will be strategically, we put dialysis there. That's one. 2, this government doesn't look at only the buildings. We look at the human beings. We continuously be expanding our training centers. For example, if you go to University of Health and Life Sciences, which His Excellency late President J.E.A. Mills put up. Since he put it up through a loan of 20 million by the Japanese, the same Japanese, through this government, has put up a 60 million center for midwifery and maternity students. It has one of the biggest simulation centers in the whole Africa. It can take 1,200 students at a time. So it's training our nurses in midwifery and nursery so that they know what they are supposed to do. Agenda 111 in all the hospitals we are putting up, the 47, the 17 that we are starting and all these things, is going to also create areas for them for training so that all these hospitals can train. 2, this government also looks after even training, recruitment. It has recruited more nurses than anybody. Between 2013 and 2016, during the President Mahamad's time, they didn't recruit a single nurse. We have to come back and then recruit all of them. It was even during COVID period that we recruited over 50,000 health professionals. And Agenda 111 is coming to create over 70,000 health professional jobs. So my young nurses and this thing who are all at home, that we are going to take you. And then recruitment of the 15,200 has started.
Okay,
they are placing them. 2, 3.
No, we don't have time.
No, let me conclude.
We don't have time.
Let me conclude.
So in 10 seconds.
In 10 seconds. Apart from this, we are looking at also AI for distribution, supply chain management system, and then vaccines and other biological production. So that it's a holistic system that we are doing. And the national health insurance, which has become very easy to access. And then we are also strengthening national health insurance so that you can have affordability and also accessibility. And then we achieve quality universal health coverage.
Doc, thank you very much. Dr. Anthony Nsiah Asare, Presidential Advisor on Health, telling us what the NPP government has done in the last 8 years and what Dr. Mahamudu Bawumia will do if he's given the opportunity to be the President of the Republic. It's been another exciting edition of the Manifesto that came to you live from our studio here in Accra. My name is Sami Wiafe. So we come your way again. Be good.